see you there. My name's Dr. Polzin, and I'm an osteopathic physician. I wanted to make this video showing some osteopathic bodywork techniques that can help you boost your immune system and clear infections or prevent them. The human body has an ability to heal itself through our immune system, and I feel like as a physician I should share some techniques that we could all use on ourselves, loved ones, or patients in this time. First, let's go over some basic anatomy. Your immune system is comprised of a lymphatic network made of lymph nodes and lymphatic vessels. So here's a good picture. You can zoom in. So here you can see a network of lymph nodes, which are these little circles here, and lymphatic channels, which are all these lines here. In general, the lymphatic system follows the venous, arterial, and nervous system throughout your body. So you can see you have a lot of different blood vessels coming here, and one of the most important lymphatic areas is going to be your lymphatic duct right here, or your thoracic inlet on the left side. Basically, this is where the immune system or the lymphatic system comes into the center of your body and circulates. As you can see, this part of the body is covered by multiple layers of cervical fascia, which is basically like the skin you would see on a raw chicken, superficial muscles, like this big flat one you see here, and deeper muscles. You can see how many there are there. The scalenes, trapezoid, you've got your sternocleidomastoid over this area, so a lot covering this lymphatic duct here. Another important part of anatomy when it comes to the lymphatic system is the diaphragm. You can see here this lymphatic channel comes all the way down and it follows your vena cava, which is your main large vein, and it follows your aorta, which is your main large artery, down. And all three of those come through this large flat muscle that is the primary muscle for breathing, and it's called the diaphragm. So this is a really important part of anatomy when it comes to your lymphatic system as well as your blood circulation system. If this muscle is tight, it can impinge lymphatic flow, which will infect your immune system, venous flow, and arterial flow. So it's a really important piece of anatomy as well. Here's another view of the diaphragm from below. You can see the aorta coming out here through the diaphragm, the vena cava, which is the large venous vessel, and your esophagus as well. Unfortunately, this picture doesn't show the large lymphatic channel that also comes through. But as you can imagine, if this muscle contracts and is very tight, you can impinge blood flow and lymphatic flow and, digestion and breathing. So it's a very important muscle. Pressure in that area, you want to take the patient's arm or your friend's arm and move it through the whole range of motion that the shoulder can do. So across the body, out to the side, down to the side of the table or the bed or the couch, whatever you're using. You can come up or on the patient's head. Just go all the way through the motion of the shoulder, and try to have the patient not use their strength, not help you move it. You want to move it for them without them using their muscles there. So this technique is really important for your lymphatic and immune system because it's where your lymphatic system drains into the venous system. So if this area is congested or tight and it's not able to drain properly, it's kind of like trying to use toothpaste with the cap on. You're squeezing it and it's not going anywhere. So it's really important to treat this area and soften it up so that your lymphatic system can flow and function efficiently. This technique is going to be called the diaphragm release technique. The reason this one is important is for the reasons I talked about earlier in the anatomy videos. Your immune system or your lymphatic system has a lot of vessels that come through this big broad muscle called your diaphragm underneath the rib cage. And a lot of times when we're anxious or based on our posture or just over time, the diaphragm becomes tight. It's the primary muscle that you use to breathe. So, imagine that you're feeling anxious, you may have a tightness in your diaphragm and not realize it. So the way we start the technique is we feel right here at the sternum and we feel down to the xiphoid process, which is this little notch right here. You should kind of feel a divot between this xiphoid process and the rib cage here. It should sink in like a little divot on each side. So you kind of just feel there and you ask the person if it's tender. So is this painful or tender?
Yes.
Yeah, so it's a little bit tight. And I feel that it's a little bit tight under my fingers as well. So I find that little groove between the bony landmarks right there, and I put some pressure there. And while I'm putting the pressure, I ask the patient to take really deep breaths through their belly. So when they take a deep breath, I want the belly to rise, and when they breathe out, I want the belly to fall. And so while they're doing that repeatedly, I keep this pressure downwards. When they breathe out, I let my fingers sink in. When they breathe in, I don't let my fingers come back up. So each time coming down with a little bit more pressure and then holding to the new depth. So after a few rounds, your fingers will sink pretty deeply as the diaphragm relaxes. So you can do this for about 30 seconds. Some people feel that it's really tender and they can't really do it for too long, so however long you're able to do it is good. And you can treat both sides, and it can help to do kind of a rocking motion as well. This final technique is going to be called the OA release. This is a technique that is helpful for draining the lymphatics of the head and the sinuses. So you start by removing the pillow. You have your partner laying down on their back, and you take all of your fingers here and you go right to the base of the skull here. So you'll feel kind of a little divot down here, and that's where you want to be with your fingers. So I'll have this hand kind of right here, and then mirror that on the other side as well. So what I want is my fingers to be sticking up like this and putting some pressure there on the back of the skull. And the patient, just go ahead and lay there. They just let their head be heavy and they just kind of sink into your hands. So once you got your hands into position and you're feeling comfortable, you want to pull towards you and up a little bit. So what you do is you just lean back a little bit and you pull some traction. It really helps when the patient takes some deep breaths through their belly, just like the last technique. And so you hold this position with that, gentle traction, keeping that constant for maybe 90 to 120 seconds. You can do it as long as you'd like. And usually this one feels really good on the person you're treating. So not only does it feel good, but it also helps drain the sinuses and drain the lymphatics of the head. You can also practice these techniques on yourself, even though they're a little bit more effective when you're treated by somebody else. So for the first technique, the thoracic inlet technique, you go ahead and just find your clavicle right here. It's this big bone, and you take your fingers and you put it right behind. So you might feel that it's really tender. On me, it's pretty tight right now. So, you just kind of do the same thing as we saw in the earlier video. So you just keep that pressure and you bring your arm through all of the ranges of motion that you can, reaching up, bring it across your body, bring it around in circles. You can get pretty random with the movements, but just go all the way through your range of motion while keeping pressure here. And you'll feel like it's a little bit tight and uncomfortable, but that means it's working. Here I'm going to demonstrate how you can do the diaphragm treatment technique on yourself. So you want to go here, you want to feel your sternum right here, come down until it forms a little bit of a notch right here. So you'll feel your rib cage right here, and you'll feel your xiphoid process right here. So you want to take 1 or 2 fingers and push them deep into this area right here. While you're doing that, you want to take some deep breaths and expand your tummy when you breathe in and let it fall when you breathe out. So I'll demonstrate. And each time that you breathe out, you want to sink your fingers deeper into that space. And when you breathe back in, you do not want to let your fingers come out. So. You do that for about 90 seconds or 120 seconds. This last technique is the OA technique, and I'll show you how you can do it on yourself at home. So if you have something like this dryer ball or a tennis ball or a grapefruit or a lemon, any of that will work. So let's try it. Go ahead and you lay back. You find that same spot in yourself at the base of the skull, and you can put whatever you're using right at the base of the skull there. And you let the weight of your head go ahead and rest on it, and then what you do is you scoot a little bit towards your feet until you feel a little bit of traction in that direction. And basically you just lay in this position, take deep breaths through your belly, let it rise and fall, and you can hold it as long as you want. You could take a nap like that if you're comfortable, and you'll probably wake up really relaxed. This technique is really important for another reason as well. Your vagus nerve that controls your parasympathetic nervous system, your rest and digest system, comes out of the skull right in this area. So treating this area can calm nerves, it can help with digestion, it can help with relaxation, which also helps with the immune system. Oh, hi. So, thanks for watching our video on these techniques. I hope you find them useful. Go ahead and follow us for future videos on nutrition, wellness, and other bodywork techniques that you might find helpful for improving your health. Let us know if you have any questions or any requests on topics for us to cover. Go ahead and follow us on Wild Bear Medicine on Instagram, or YouTube, or possibly IGTV. Thanks.